COVID-19 has impacted Europe in a much more significant way than here in North America. And certainly, you're talking about the movement of refugees and migrants at this in that part of the world. Carl Hétu is with Catholic Near East Welfare Association and joins us today. Carl, it's been a while. Welcome back. Good to speak to you again.
Yes, it's a pleasure to be here. Yes.
So tell me what the situation is now and how COVID-19 has impacted refugee movement in Europe.
Well, you know, when we look at what's going on in the Middle East in particular, of course, here you are. If you go to Iraq, Iraq is a country that's been in conflict, war, different crisis, economic crisis. The entire health system has collapsed. Of course, there's good hospitals, there's good health clinics. Some of them we support, but they just cannot face what's coming to them. And if you look at Iraq, for example, there's been, because of the Islamic State of 2014 to 2017, there's been thousands and thousands of families that have been displaced, people that lost everything, refugees within their own country. And now we hear that, of course, large segment of the Iraqi population are Shiites. They went in the last 4 weeks or so, to Iran for a big pilgrimage because Iran is Shiite. And now they're all back in Iraq. Can you just believe the spreading of this all over Iraq? And most likely, most people don't know what they have, and they will never be tested because there is no test available for most people. On top of that, Iraq is facing a near civil crisis where people are demonstrating against their government that is totally corrupt. And so what you have here is just a crisis there. If you go to Syria, in Syria, as you know, it's been a civil war since 2011. The entire health system is totally collapsed. The only maybe advantage this time is nobody has gone visiting Syria. You know what I mean? The only problem is that there's been some Shiite Iranian militia that have been helping the fight in Syria. So you can just imagine those Iranian militia coming in Syria, fighting and passing this coronavirus. Nobody knows at this time because here again the testing is almost impossible. Then you go to Bethlehem, not far ago in the Holy Land, where 5 million people yearly go to Bethlehem to the Nativity where the Lord was born. And so, of course, what happened is 12 days ago, there's a group of pilgrims from Greece that had the virus. They didn't know about it. And, of course, 7 Palestinians in a hotel, one famous hotel in Bethlehem, got contracted. They had the positive results of that disease. And so, of course, here again, the Palestinians are not equipped to deal with this. So basically, from the day one they knew about this, they closed down everything. Bethlehem, Beth Sahur, and Beth Jala, the cities around Bethlehem, were totally emergency from day one. No social gathering. All churches closed down. Mosques closed down. People could not just go anywhere. People would be arrested in the streets if they would be seen walking to places. So in order to do what? To contain it. So from 6, it went to about 40 cases at this moment. Is it wider? Quite possible. So what we see happening in this entire Middle East is that because the health system is not well equipped, where there is no, as you can imagine, if everything's blocked up in Bethlehem per se, that means economic chaos. Tourists have been sent back home. And that means a society that depends about 60 to 70% on tourists. Clearly, that's going to be getting even worse. So that's a bit the situation that we're facing in the Middle East at this moment.
And there's still widespread movement of refugees too, right, Carl? The people who
but the refugees, you know, there's 1 million refugees in Lebanon from Syria. There's Iraqi refugees going to Jordan all the time, and so right now they're blocked there. They're not going anywhere. All the countries have blocked up their frontiers, so nobody can go in Europe right now. Everything's been blocked. Nobody will be coming to Canada. It's been blocked. So you have refugees that have lost everything from Syria or from Iraq that are in Lebanon and Jordan. They've been waiting, some of them 5-6 years, and now suddenly this coronavirus is coming in. In Lebanon, we have an office there, and our director was telling us that it's total panic. Everything is out of control. The government is at the verge of collapse, economically speaking. It's totally corrupt and totally falling into bankruptcy. And so people don't know what to do except self-imposing the quarantine. But this is very, very terrible over there. And the refugees that are there, on top of being refugees, on top of having nothing, end up with this. Don't think they'll get too much treatment on it. So we might expect a high level of death in the coming weeks, if not months, in Lebanon, in Jordan, in Iraq, and other parts.
Carl, our time is always too short, but I hope we can talk again soon about this and get an update from you.
Yeah, absolutely. We're here, and if I may just say just a little invitation, as we are focusing, rightly so, into Canada and saving ourselves and helping one another, as our Prime Minister and our premiers are saying, and to be careful. Let's also keep in mind that there are people already very poor worldwide that are going through a hardship as well, and let's not forget about them. Here I'm not saying people should sacrifice their local aid to local people, but at the same time, if you're able to, do not stop to give to your own charities that do exemplary work overseas. And so, of course, that includes us, but many, many others as well, that counts on people's generosity to continue have people living in dignity worldwide.
Carl, merci bien, and again, we will talk again soon.
Absolutely. Thank you.
Carl Hétu is with the Catholic Near East Welfare Association. He spoke to us from Ottawa.